For Adstiladrin administration, you will start by protecting yourself with gloves and a waterproof gown. You will protect the environment with a drip pad. We will be using a closed system transfer device to draw up the medicine and to administer the medication. So you will need the valve spikes. The valve spikes will connect directly to the syringe with the closed system transfer device. And then you will have the cap to put on the syringe once it's drawn up. You will have alcohol wipes. The Adstiladrin will come in a box with 4 vials. Each vial contains a minimum of 20 mLs. You will draw up a total of 75 mLs per dose. We will also send an EquiShield Lock adapter, and this will go right into the straight cath, and you'll be able to administer directly into there. It will look like this when it's assembled. To begin, you'll go ahead and pop your tops. You'll wipe with alcohol. You'll then take your vial spike adapters, and then you do have to push down pretty hard, and you'll hear that click into place. And then you'll repeat that for all 4. Once you have the vial adapters onto the spike adapters onto each vial, you'll go ahead and take off the red covers. You'll wipe them again with alcohol. You'll scrub them correctly and let them air dry correctly. You will line this up. The red lines will go with the red lines on the spike. Adstiladrin is a 75 milliliter volume dose. You will draw up 40 milliliters into one syringe and 35 milliliters into the other syringe to total a 75 milliliter volume. Because this technology has a vent in it, you do not need to inject air into the glass vial. Because this is a closed system transfer device, no vapor or liquid will escape either from the disconnect, because it is a membrane to membrane, or from the back of the syringe. Because you aren't going to be administering this immediately, you do want to cover this with a sterile protector. Be careful not to touch it with your hands to maintain sterility. You can touch the outside, just not the inside. So we're going to repeat this, but instead of drawing up 40 mLs, we're going to draw up, we already scrubbed the hub with alcohol. We're going to draw up the 35 mLs now. So we're going to connect this. And I'm just going to draw back. And you can see as I draw back, the air bubbles go into the liquid. So like I said, I have 40. Now we're going to go with 35. Okay. So from here, I'm going to remove this cap, open this cap, and go ahead and put it on. Not touching the inside, of course. Vials and supplies are to be disposed of in biohazard waste. Then the Adstiladrin can be administered. So the patient will have their Foley in. You will put the adapter in. When you place, so what you'll do is you'll have the patient void. You'll go ahead and put the catheter in, normal, and then you'll have the patient, any residual urine, of course, you'll let that drain. Then once that's drained, this is an end cap. It is in there. It is going to, it's just like a plug. So you'll go ahead and take this off. And then you're going to line red lines up with the red lines and go ahead and connect that. And then from here, I can go ahead and administer into the bladder, and you can see that it is filling up my little basin. And then once I'm done and this syringe is completely empty, which I'm going to stop right there for the sake of not making a mess, you want to push down on here. So you can see it pushes down. You want to push down, not too hard because you don't want to break it. You want to kind of hold some pressure on this little lip right here when you go. So that's really what you're going to pull it out from. You're going to push down gently and then just pull. And then you'll instill the second syringe, and then the Adstiladrin should sit in the bladder for an hour before the patient voids, if they can't tolerate that, as long as possible. When the patient does void the Adstiladrin, they are to be instructed to place a half a cup of bleach in the toilet before they urinate. This will disinfect their urine and deactivate the Adstiladrin. The urine and bleach mixture should sit in the toilet with for a minimum of 15 minutes before flushing. And patients should be taught to do this for 2 days after treatment.